Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 services divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Integrated Family Services Therapeutic Groups. NCSS offers a variety of groups for children and their families. A sample of these includes Sensory and Movement in You, Parenting the Strong-Willed Child, Movement Group, STEP Program, and beginning in January of 2016, the Parent Cafe. Whether familiarizing a child with their senses and learning, self-regulation strategies, applying a specialized treatment intervention for young children who have demonstrated inappropriate sexualized behavior, or teaching healthy habits and a positive sense of self, we offer groups to address these situations. Today, we'll learn more details about all of the Integrated Family Services therapeutic groups that NCSS offers. To discuss therapeutic groups for children and their families in greater detail, I'm pleased to introduce this month's guests, and they are Allison Cromp, Quality Review Specialist, Matt Hogan, Community Support Services Team Leader, and Kara Corno, Services Coordinator for the Family Support Team. I want to welcome all of you to the program this month.
Thanks for having us.
So let's start with what is Integrated Family Services and how does that differ from the models of providing services in the past?
So Integrating Family Services is a new pilot that's following the movement in national healthcare of changing the way we do things to be less about how many hours are you providing and more about is the child getting better. Mm-hmm. So we're now being held to outcomes to say maybe you can do things a little bit more flexibly as long as you're letting us know that children are getting better. So they're paying more attention to the quality of care.
And along those lines, Allison, hasn't it been a fact that at least at NCSS for quite some time, through the use of results-based accountability, we actually have started on that road, I should say, ahead of maybe what's happening more on a global scale?
Absolutely. I think Vermont is ahead, and I think in that vein, NCSS is ahead. We're one of 2 piloting agencies, along with Addison County, for utilizing IFS, and we have our community partners on board, and it's creating a whole movement of people kind of pooling resources to help with wellness and prevention, as well as specialized treatment, to just try to have a more integrative approach to healthcare and mental health.
Mm-hmm.
Absolutely. I think for me as a supervisor, I'm finding that through IFS, I'm able to say yes far more than I used to be able to. And I think that's huge, that I enjoy saying yes to community partners and to families. And so instead of saying, well, that doesn't fit inside our box that we used to offer, now it's, sure, let's try it. Let's see how we can get creative with that, because clearly it's a need of this community. And I get to say yes to that, and that's always good.
Mm-hmm. Now, due to the flexibility of Integrated Family Services, NCSS, as you've said, has been able to incorporate more groups into our treatment model. In general terms, what's the value that someone that gets involved gains from being in a therapeutic group?
I think we've seen a lot of value, and one of the biggest pieces are what children can learn from other children and what adolescents can learn from other adolescents. I think every parent would tell you, you can tell your teen till you're blue in the face that they need to do something. If they don't hear it from their peers, they may not jump on board. And so we found that peer pressure with everybody learning at the same time and learning from each other often gains some better results.
Yeah, I think it reduces this idea of, I'm alone in the work, or alone in the world of I'm the only one who's sick, or I'm the only one who has this problem. And whether it be caregivers being able to connect with each other, or kids be able to say, oh, we're similar. I'm not alone. So.
And I would say that's one of the big scenarios with virtually anyone that we treat, is the feeling that perhaps they feel they're the only ones who are struggling with a certain situation. And that because of that, of course, there's a lot of, in many instances, stigma attached to that. But the reality is there's far more people who are dealing and struggling with these situations than they would ever imagine. So therefore, being in the group setting kind of breaks down some of those barriers, makes and normalizes, I guess, the fact that there are others who are struggling with similar situations.
Absolutely.
Yes, we're doing a new assessment tool now for every child and family as they're coming in. And one of the questions we're asking is, what are your natural supports, and who do you call when you're having trouble with your child or having trouble with yourself? And 85% of parents are scoring off the charts in a lack of natural supports. And so I find one of the biggest things that we found through these groups is a lot of them have a parent component, or a caregiver component, or a foster care provider component, and they're all coming together and saying, oh geez, wow, I had no idea other parents had children with the same problems, and they're sharing information about what works. And I think they're feeling a lot more supported than they used to through that process.
It kind of opens up their community a little bit, that, okay, you're a caregiver of someone who is navigating this. I'm a caregiver of somebody who's navigating this. So that's at least one person that when I'm struggling, maybe I can call them after this is all said and done.
I find that's 85%, a very high percent. Is there anything you can attribute to that many people feeling that there is just no support system?
That's a great question. I think what people have identified for me thus far is that it's not that they don't have somebody to call for regular stuff. It's that right now they don't feel like they have somebody to call who understands the issue, or somebody to call who might take that child in for the night. And so the social and emotional issues that these children have, they feel are too much to ask for their family to help them with.
I see.
So they're in need of feeling like there's people who understand and also can provide that support, and that it's not too much to ask.
I see. Now let's talk a little bit about the different groups that NCSS offers children and their families. And can we begin with the sensory movement and you group? And what does this group offer toddlers?
I think this definitely falls in the wellness and prevention area that we're trying to beef up through Integrated Family Services, and it's for kids 0 to 5. And really it's a focus. Parents bring their children in, they participate, and their parents are educated on what some of the early things you can do with young children to help them integrate their senses to their emotions and their emotion regulation. So we've got all sorts of cool things, weighted blankets and things we do with Play-Doh and other types of stuff that really get the kids interactive. And then we help parents come up with ideas of how to bring those types of things home and use them at home. And it's just that early emotion identification and coping skills in young kids.
And tell us about the Parenting the Strong-Willed Child group. I understand that it's for parents of those with children between the ages of 2 and 8.
Yes, and this popped up due to a lot of community response telling us over and over again, I just feel like we've got younger and younger kids having more and more severe behavioral problems, and it was a need for a different type of approach than you might with an older child. And so Parenting the Strong-Willed Child comes from Dr. Rex Forehand, and we've had a lot of trainings over the years at NCSS based on this curriculum, and it's part of the family-based approach as well that we're working with Dr. Hujek to get consultation on. But it's basically just a way for parents to engage kids who are very strong-willed, very oppositional, do not like to hear the word no, and who, whenever there's a limit set, it's unpredictable. And these are parents who struggle to take these kids to the grocery store because they're worried about the tantrum that's going to happen. And so we're giving them a lot of strategies of how to deal with some of those most severe escalations.
And you're saying this was really born out of the fact that there seems to be an incredible increase of young people that are just so strong-willed that the parents just don't know where to turn and what direction to take?
Yes. I think our partners at DCF have noted this as well, and we've just, through looking at our own population, we've seen just kids coming in with more acute needs, younger children reaching the level of needing a residential care type of facility. And so in response to that, we're looking for ways to help parents have an impact before it gets to that point.
Now, another group is the movement group, and my understanding is that this group is for girls that are 14 to 18 years of age, and if you can just tell us what that group is all about and how it functions.
Yeah, so that group is geared towards girls 14 to 18, and it's to support them in developing some new coping skills in a different type of setting. So the movement group tries to incorporate active movement, so some of the things involve hiking or running. We also talk about playing basketball or frisbee, and in that we're incorporating different resiliency factors, so developing skills around increasing their self-esteem or reducing their anxiety through understanding how they take things in and how they can better deal with the issues that they're being faced with. And again, it comes into that group model, so being supported by their peers and developing connections with other girls their age that may be going through similar things, so they don't feel alone in that.
I know that some of these groups we haven't offered maybe that long as far as duration is concerned, but for the groups that we have had a little bit of more of a longer trial, do you find that after these individuals are out of the group that they actually stay connected and those sorts of social interactions take place, or is that something that just we don't have any idea, or just curious on?
I mean, it's a good question. You know, sometimes in the groups that I've run that have had multiple, we've had multiple sessions, you can see connections happening, and are they staying connected outside? I don't think there's any real way to measure are they staying connected. I do know, having seen some of the participants over again, they reflect on group quite a bit, and I do think the groups that we are running are having an impact on at least a moment in time where they can reflect back to, okay, this is why I'm really here, or this is what I'm really working on. Mm-hmm. And so if they're passing the hall and they see any of us, they can say, like, hey, yeah, you were that person. So are they getting together outside? I don't know, but I do think it is having an impact.
Mm-hmm. Now, what is a STEP program, and who would attend that particular group?
STEP program is, I think it's really exciting that our community finally has this up here. It's a multi-family therapy group for children ages 6 to 12 that are demonstrating inappropriate sexual behaviors. And anytime you add the word sexual into something, it becomes, I would say, hyper-stigmatized and becomes very scary. And what's so great about this is it gets these kids in 6 to 12 and gets them a lot of psychoeducation and support, families psychoeducation and support, and our goal is to prevent any future or further problematic sexual behaviors. So it's working with parents around what are the appropriate supervision styles that are needed for their kids, and kids talking about what are appropriate boundaries between what is okay and what is not okay. And I think sometimes we hear sexual and everything is problematic, everything is concerned, everything is I need a professional, and we do a really good job, I think, supporting families to explore what is normal, what is of concern, and what is seek professional help, because there is a wide range, and helping a family understand what a 12-year-old might be going through versus that might be actually quite normal versus what is problematic and that we need to be very vigilant on. And,
Yeah, and I think the great thing also about that group, again, is the parenting aspect to that. So the groups take place concurrently. So there's the children's group taking place at the same time that a parenting group is taking place. And so in that respect, those parents are also having the opportunity to connect with other parents that are experiencing similar issues with their children. And especially, like Matt was saying, when the word sexual comes up, that becomes very stigmatizing, and it can be difficult for parents to try and open up with others about that. So,
and I think it really it normalizes parents talking to kids about sex, and I think that how do I talk to a 6-year-old about sex? And it's it creates an environment that is safe to say we're going to talk about this every week for 12 weeks. We're going to come here, we're going to share a meal together, you're going to do some work, I'm going to go to some work, then we're going to come back, check in with each other, and we're going to go home and practice our skills, and then we're going to come back. And I think it just helps connect people, families to feel like they're not alone, but also helps connect children and caregivers. So we've in the groups we run so far, there have been biological parents, they have been adoptive parents, there have been foster parents. So it's really the primary caregiver in this child's life. As you know, how are the two of us going to communicate around this issue?
Well, and you say a 6-year-old or what have you, Matt, one of the fascinating things in general when we talk about society today is the fact that kids younger and younger are being exposed to messages that, years ago, it would have been 5 or 10 years later perhaps. So that, of course, in and of itself is going to create a whole different scenario within the family unit as to when is the right time to perhaps broach certain subject matter, because even without the knowledge of the parent or caregiver, a young person could be exposed to all sorts of information that they then begin to, whether it's emulated or whatever the case may be. So I can imagine that this is the type of group that, as time goes on, will, I would think, be a very sought-after group to be a part of. And that's just my non-clinical view. But I really do believe, though, that with all of the bombardment of messaging the kids get from every facet of technology,
and it's completely, I don't say accidental, it's very intended by the media or whatever, but TV commercials, it's not, the kids don't have to be actively accessing it to come up across something that is maybe not age appropriate for a 6 or even 12-year-old.
Absolutely. Now, I also understand that we're going to be introducing another group, or a new group, beginning in January of 2016, called the Parent Cafe. What is that going to be all about?
The Parent Cafe is, again, just another opportunity for parents to come together and talk about their issues. So it's not specifically about like sexualized behaviors, but more about the everyday parenting issues that they are running into. And it's coming off of the strengthening families idea and developing those protective factors for parents to bring home as well. So it'll be a great opportunity for parents to come together and talk with each other and then be supported by clinicians as well in those conversations.
I think what we found is that when you get a bunch of clinicians in a room, we can come up with a lot of great ideas on what type of therapy kids would need or what the needs are of the community. But at times when you try to pass the reality test of what parents and caregivers are really going through and what's realistic, we find that they have so much to offer in terms of what are the barriers for the real reason why maybe that child's not getting better. Maybe it's just transportation. Maybe you could have the best treatment in the world, but we can't get them to those appointments. And there's a long list of those things, and I think what we're trying to do more of is get that feedback from parents and caregivers in our community so that we're not just making these decisions in a vacuum, and we're trying to partner with them a little bit more to develop the programming that fits.
Excuse me. You know, when I look at the difference between individual treatment and, say, group, are you finding that people are much more amenable to wanting to get into a group setting than maybe in past years, or is it more difficult?
I think in the so if I look at STEP specifically, as that's the one that I primarily run, by the time referrals are coming to us, typically those families are ready for the treatment, that they're very active in wanting. So I think at that point it's very specific. It might be an answer to what they're experiencing right now, that they are motivated to get there. And you know, transportation is a huge barrier, and so working with you know, other community partners, like, you know, supporting getting cabs to get families to group, and families are being able to come. So I think maybe they're just more ready for the treatment at that time because, well, again, in STEP they're very motivated by the we need to fix this problem.
By the time the circumstances have now driven them to the point of that. So I can't believe it, but our time is up for this month, and time certainly has gone fast today. I want to thank my guests, Allison Cromp, Matt Hogan, and Kara Corno, for being on the show today and sharing their insights on the various therapeutic groups that NCSS offers for children and their families as a part of the Integrated Family Services. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.